Hello, my name is Dr. Curisa Tucker. I am a nurse scientist at the University of South Carolina College of Nursing. I'm originally a labor and delivery nurse with 10 years of bedside experience, and I'm one of the authors of the paper that we're talking about today. Well, as a former labor and delivery nurse, I cared for women who survived life-threatening complications and were sent home without anyone really asking them what their experience was like. Severe maternal morbidity affects up to 2% of births every year in the US, and Black and Latino women experience it at nearly 3 times the rate of white women. Obstetrics and Gynecology Journal reaches the providers who need to hear these stories, including clinicians who are at the bedside making decisions every day. A special issue on maternal morbidity and mortality is exactly where these survivor stories belong, because they hold knowledge our quality metrics simply can't capture. We wanted to understand what severe maternal morbidity actually feels like from personal stories, not just the clinical event, but everything around it. For example, how women knew what was wrong, whether they were believed, what recovery looked like, and how race shaped every step. Centering Black and Latino voices wasn't symbolic, it was because these are the women who are affected the most. And what we heard was clear, a clear unifying message. They wanted to be seen and treated as whole human beings, not just as a diagnosis. So as a team, we co-developed the 5 recommendations with our Community Advisory Board of Survivors. First, including patient perspectives when developing patient safety policies because survivors see gaps that systems miss. Second, implementing care navigators to support timely communication and coordination, especially during transitions. Third, provide obstetric-specific trauma-informed care training for clinicians and staff across units. Fourth, integrate mental health services for patients and their support persons throughout the postpartum period. And fifth, practice respectful, intentional, empathetic communication. These need to be addressed at every level, including policy, organization, clinician, and patient levels. The biggest message is that clinicians really need to listen. Survivors want to be seen and heard as whole human beings. They are not just data points in a morbidity rate. Rather, they are experts on what went wrong, what helped, and what needs to change. If we want to close the maternal health equity gap, quality improvement has to be built through their knowledge, not around it.